A client with rheumatoid arthritis is being treated with daily steroid medication. Which food should client avoid? A. Raw YSTERSB cottage cheese. C. Baked chicken. D. Green beans.
The right option is A.
The physician has instructed the client with gout to avoid protein sources of purine. Which protein source is high in purine? Dried BANSB and UTSC cheese. D. Eggs.
The right option is A.
The nurse is caring for a client with a long history of bulimia. The nurse would expect the client to have extreme weight loss. B. Dental caries. C. Hair loss. D. Lanugo.
The right option is B.
The nurse is providing dietary teaching regarding low sodium diets for a client with hypertension. Which food should be avoided by the client on a low sodium diet? A. Dried BANSB Swiss cheese. C. Peanut butter. D. American cheese.
The right option is D.
A client is admitted to the emergency room with partial thickness burns of his head and both arms. According to the rule of nines, the nurse calculates that the total body surface area involved is 20%, B. 27%, C. 35%, D. 50%. The physician has ordered a paracentesis for a client with severe sites. Before the procedure, the nurse should A. Instruct the client to avoid B. Shave the abdomen and C. Encourage extra fluids. D. Request an abdominal x-ray.
The right option is A.
The mother of a child with chickenpox wants to know if there is a medication that will shorten the course of the illness. Quick medication is sometimes used to speed healing of the lesions and shorten the duration of fever and itching. A. Zoviraxacyclovir. B. Varivax varicella vaccine. C. VZIG. Varicella zoster immune globulin. D. Periactin cyperheptidine.
The right option is A.
A hospitalized client with severe anemia is to receive a unit of blood. Which facet of care is most appropriate for the newly licensed practical nurse? Initiating the 4 of normal saline. B. Monitoring the client's vital signs. C. Initiating the blood transfusion. D. Notifying the physician of reaction.
The right option is B.
To reduce the possibility of having a baby with a neural tube defect, the client should be told to increase her intake of folic acid. Dietary sources of folic acid include meat, liver, eggs. B. Beef, fish, chicken, oranges, cabbage, cantaloupe, dried beans, sweet potatoes, Brussels sprouts.
The right option is C.
The physician has prescribed nitrogen buccal tablets as needed for a client with angina. The nurse should tell the client to take the tablets after engaging in strenuous activity every 4 hours to prevent chest pain. When he first feels chest discomforted, at bedtime to prevent nocturnal.
The right option is C.
The nurse is caring for an infant who is on strict intake and output. The used diaper weighs 90.5 grams. The diaper's dry weight was 62 grams. The infant's urine output was 10 milliliters. B. 28.5 milliliters. C. 10 grams. D. 152.5 grams.
The right option is B.
The nurse is teaching the parents of an infant with osteogenesis imperfecta. The nurse should explain the need for additional calcium in the infant's diet. B. Careful handling to prevent fractures. C. Providing extrasensory-motor stimulation. D. Frequent testing of visual function.
The right option is B.
The nurse is preparing a client with gastroesophageal reflux disease G or D for discharge. The nurse will tell the client to eat a small snack before bedtime. B. Sleep on his right side. C. Avoid colas, tea, and coffee. D. Increase his intake of citrus fruits.
The right option is C.
The nurse is caring for a 3-year-old In a wet hip spica cast made from plaster of Paris, when turning the 3-year-old with a wet cast, the nurse should A. Grasp the cast by the HA and D. B. Use an assistive sling. C. Use the palms of the hands. D. Obtain a lifting device.
The right option is C.
A client has a diagnosis of discoid lupus. The primary difference in discoid lupus and systemic lupus is that discoid lupus A. Produces changes in the kidneys. B. Is confined to the skin. C. Results in damage to the heart and lungs. D. Affects both joints and muscles.
The right option is B.
The nurse is preparing to walk the postoperative client for the first time since surgery. Before walking the client, the nurse would A. Give the client pain medication. B. Assist the client in dangling his legs. C. Have the client breathe deeply. D. Provide the client with additional fluids.
The right option is B.
The physician has prescribed gantris sulfasoxazole, 1 gram in divided doses for a client with urinary tract infection. The nurse will administer the medication A. With meals or a snack. B. 30 minutes before meals. C. 30 minutes after a meal. D. At bedtime.
The right option is B.